Hi, and welcome back. I'm Dr. Brian Hutchison here with Craig, and I thought it was interesting to speak with Craig today because, Craig, you've been going through the mostly remote curve correction program for about a month and a half now, and I'm just curious, tell us how it's been going for you.
Yeah, no, it's been great. It's been easy to do, just at my apartment, 7, 8 times a day, 35 minutes at a time, and it's only been 5, 6 weeks, and yeah, I was a lot of the symptoms from the vagus nerve, the anxiety, the heart palpitations, which I was dealing with, are pretty much minimal at this point, which has been fantastic. Still have a lot of the head pressure and vision symptoms and brain fog, but this was a 5-month plan. We're only 6 weeks into it, so I'm excited to see. And and today was a pretty pivotal visit. So.
Yeah. So just a few minutes ago when we were walking in between the building and outside, what was it again? How did you feel? You said that...
Yeah, I felt awake for the first time in years, to be honest.
Wow.
And it was a very refreshing feeling. So.
Good. So feeling awake, almost like you felt more clear, you said. Things were... What word did you use to describe it? You said...
I just felt present.
Present, yeah.
Yeah, because with the anxiety, the depersonalization, derealization, you don't feel present. So that was, it was an awesome feeling. So
good. So you've had the depersonalization, anxiety, tachycardia, also the brain fog, the head pressure, and things that an otherwise healthy person, you've had a hard time finding out what to do, right? You've been researching, and you've been to several other doctors. Have you been checked out like by a neurologist or by a cardiologist or?
Oh yeah, everybody. Neurologists, cardiologists, I saw an ENT, eye doctors, neuro-ophthalmologists, and yeah, that all comes back that I'm healthy when you know that you're not, so.
Yeah, and so since you found us, which we're super grateful that you did, it's been a month and a half. We only saw you one visit. This is your second time with us ever connecting physically in person.
Yeah.
Right? We've done it several Zoom calls because part of the curve correction program is we hop on a call together and we make sure you're doing your homework just right. And we helped you a few times. We said, okay, now, made a little fine tuning to your positioning, but one visit and you said almost all of your tachycardia and anxiety is gone, and you're starting to feel present and just aware for the first time in years. So we're so grateful. We know we still have some work to do with the brain fog and the head pressure. And can you share just what did we do today to try to take you further with the brain fog and also the head pressure?
Yeah, well, we did the sacral weight because I was obviously having some issues down here, and like you mentioned, you need the entirety of the spine to be working for everything to be efficient. So we had the sacral weight, and then the biggest thing with the jugular vein drainage was really focusing on pushing the bone back on this side because that's where it was getting kinked. So just testing that with the ultrasound and showing that that's something I can do at home was great to see.
Yeah, we found, Craig, that not only is your internal jugular vein closed in the lower right of your neck, but also when you're laying on your back, which is supposed to be the one position where everybody's vein should be draining. And yours, for some reason, well, it's partially because you have a scoliosis through your spine, a gentle scoliosis, but also your lower bones on the right are too far forward. So when you're laying on your back, your veins are draining great on the left, great on the top on the right, but it was closed in the lower right. So we gave you some exercises, right? Some specific exercises for you that are going to allow your body to take pressure off that vein. We saw the vein open, and we're teaching you with the weights. We made some unique modifications to get it draining, and we're just excited for you to keep getting better. So thank you so much for being part of the program, and we're glad that you're really on the right path.
Yeah, thank you both. This has been great.
Good. Thank you, Craig.
Of course.
Okay.